what I'd suggest, Maricela, is to technology during COVID. Sorry about that.
No problem. Yeah.
That might help if she just logs in and out. That will probably, hopefully fix it.
Of course.
So our primary focus today is to talk to you about the work that we do and the structure and system in Orange County for people accessing public benefits. We're going to touch on some stats for people that are uninsured and the resulting health disparities. We sent you 2 documents that that you probably have seen before, and we'll ask you some questions along the way, and there will be some gift certificates tied to those, so we'll give you a chance to win them. So my associate Maricela is coming. She's trying to come on. Let me see. This is going to take a moment, everybody. Reese, you don't have access.
I can share the slides if that is easier for you.
Yeah, for the
and then
moment.
You can just
yeah.
prompt me. Okay.
Yeah, for the moment, if you don't mind.
Okay.
Hi, Gregory. And sorry, technical difficulties here. It looks like every time I have my video, your audio on your end, so I can't hear anything. So I think I'm just gonna have to. You guys won't be able to see my face now. Sorry. I'll be doing you a favor.
Yeah.
No.
This is the story of the limitations for a grassroots nonprofit.
I'll go ahead and share the screen. Okay, how are we able to see it on the screen?
Yeah, perfect, Marty.
Okay.
So we really want to encourage you to ask questions as we go through the material, and Reese is going to assist us with taking note of what's in the chat and then relay those questions on to us. So we're going to go to the next slide with the agenda. So here's what we want to cover today. And as I mentioned, we really want, as we go through this, we really encourage you, there's no wrong question. I mean, perhaps you know a lot more about it than we're aware, and so we're not sure, but those things that you don't know about and you want to know more about, please let us know, because it is very different in every county and every state. So we're going to go to the next slide. So CHIOC, you can see our mission there at the top, to connect all children, families, and other adults to affordable and quality healthcare and social services. We started out as a safety program, safety net program through Health Funders Partnership, and we were under another nonprofit. And then in 2015, we stepped out on our own and established our 501c3 nonprofit corporation status. We've got a board of directors, and our executive director is Georgina Maldonado. We have 15 different staff people, and 7 of them, as you can see, are certified enrollment counselors. That's a term really being used by Covered California, the Affordable Care Act program, but we refer to them as health assisters here internally. Then we have 2 individuals that play a key role in educating and getting people to the point of enrollment. We have 2 outreach coordinators. Maricela is the lead coordinator in that area. And then we have staff that we refer to as 1EAP staff. 1EAP, that is it's a combination of a customer relationship management tool and a enrollment portal. And that is all changing very, very soon. So we're going to change their names. And then we have other staff that you typically find in a nonprofit, the fundraising people, the management people, and people doing community relations. We just want to share with you that it takes a village to do this work. And so we get support from a range of parties, primarily through contracts with either the state or the county, and then support from some different types of local funders, and then a small amount of funds from other areas. We're going to go to the next slide. We have, we have 3 different programs here, and the largest is our Education, Enrollment, and Navigation Services, which we refer to as ORU, or the Outreach, Enrollment, Retention, and Utilization Model. There's a number of organizations across the state and across the nation that do the type of work that we do, but only a limited number of them follow this model. And some of the critical pieces are the utilization piece, making sure that people, once they apply for public benefits, that they actually can retain them. And then the process to help them renew their benefits. In addition to that, we have what we refer to as our regional health leadership efforts, which comes in the place of the Orange County Health Access Enrollment Task Force. We have about 250 members from nearly 40 different agencies. Most of them are focused on either health or social services that we meet monthly. And we talk about all things healthcare enrollment related and social services related. And then we do a little bit, not a lot,
Children 0 to 18, regardless of full scope Medi-Cal. And as of 2020, young adults 19 to 25, regardless of immigration status, can also obtain full scope Medi-Cal, which gives them access to a primary care provider, a dentist, and an optometrist if they need it. For those who may not be eligible, their income may be a little too high for Medi-Cal. And if you fall within 366% of the federal poverty level, they may be eligible for a program in Kaiser called the Kaiser Child Health Plan, and we can assist families with that. For those who do not have a satisfactory immigration status here, what they would be eligible for, they can still get a program for Medi-Cal. It would just be restricted. So the restricted scope Medi-Cal covers emergency services and pregnancy-related services. For CalFresh, CalWorks, General Relief, and the CHDP programs, families and individuals do have to be citizens or legal permanent residents to obtain these services. Some visas do qualify for these services, such as refugees, asylees, VAWA, trafficking. All these programs, again, the only reason why they ask about their immigration status is just to place them in the correct program. That information will not be used for anything other than those purposes. The other services we assist with are referral programs. If we identify that the families can receive additional assistance either through programs like CARE, FARA, LEAP, CLTP, CDP, LEHAPE, those are programs for utilities, so they'll be able to get a discount on their utility bills. Programs like WIC for children, for pregnant mothers to 5 years of age, we can refer them to WIC if they qualify so that they can receive services, just additional food and nutrition programs. For those who are pregnant and have children, I think it goes up to about the age of 1, the first year of age, we refer them to the MOMS program. The MOMS program also assists the families, especially if they're new moms, so that they can get additional support through, here in Orange County. Oops, sorry, 1 second. Okay, so the enrollment process, this is a little bit of how families come to us and how they find us. We have, before COVID, we used to have 22 satellite locations all over Orange County. The families could come into either a clinic, we were at community-based organizations, we were at WIC offices. They can go into the office, make an appointment, see one of our enrollers, and submit an application. And from there, determining the eligibility, they could either qualify for Covered California or for Medi-Cal. If you notice down where it says County Social Services Medi-Cal, after they've been approved for Medi-Cal, they still need to take another step and be enrolled into CalOptima. If they live in Orange County, they automatically get enrolled into CalOptima, but they need to know that CalOptima, the only thing that they do is they choose the medical group. And that's really important because it determines where they can go to the doctor and get their primary care provider. Also, if they don't have or don't qualify for Medi-Cal or Covered California, we do also make sure that we connect them to community clinics. That way that we know that they can get some kind of care. And I think, Gregory, we're ready for our first raffle.
We are, but let's check in with Reese. By chance, does anyone, we're going to ask a question, but does anyone have any questions for us, Reese?
So far, it doesn't look like we've received any questions in the chat box so far.
It might just be moving to a separate topic of discussion. But you had talked about some of the advocacy work around the Senate bill, and I think there's interest to understand, like, how does CHIOC sort of identify, legislation to engage in advocacy about, and what's the process like? How does CHIOC actually initiate those interactions with elected officials and others?
That's a very good question. And we are fortunate to rely on a statewide group called Health for All. And they have the staff that actually have a very up close look at the discussions with the legislators and the development of the policies. And so we collaborate with them and let them know that, we're interested in health access for all and improved quality of life for all in terms of other public benefits like CalFresh and CalWorks. And so we try and stay abreast of all of the different legislation that's being developed, and then working with our partners, Health for All, and other partners too. That's when we join in and have conversations with local elected officials, and that was for both, state legislation and also federal legislation. So we have a pretty narrow focus in terms of health access. So right now we're looking at issues in terms of SB 56, which is the full scope Medi-Cal for undocumented seniors or older adults, and AB 4, which would actually be full scope Medi-Cal for everybody, no matter what your status is. We also try and learn and support other types of legislation that have to do with affordability, whether it's reducing the asset test for Medi-Cal and other types of things that are going on. We're, as a small nonprofit, there's no way that we can be able to track all of that. So we're fortunate to have a partner like that helps us walk along.
Great.
So our question, we sent out to a couple of reports to you. One of them is the Orange County Healthier Together, which is a community-wide initiative that aligns public and private resources within the public health system to improve all health for all the communities in Orange County. This initiative is led by the Health Improvement Partnership, and we sent you a copy of the 2022 Health Orange County Health Improvement Plan that lays out the assessments, the goals, objectives, and strategies. We want to find out if at least one of you read them. So according to the HIP plan, the Health Improvement Partnership Plan, what is the ratio in Orange County of persons that are uninsured compared to those persons that are insured? Now, if you're digging for it now, that's fine. Some of you might just guess and get it.
It's ratio of uninsured to insured?
Yes.
Okay. I know the answer, but you also told me the answer previously, Greg.
Yeah. Well, the one thing I want to tell you about that answer, Dr. Belamek, is that, it depends on what data you're looking at. So I'm going to share a number today. I'm going to share a percentage at the beginning of this conversation and a different percentage near the end of it. So it depends on what data you're looking at. So do I have any takers? Yeah, how about a guess? Just give me one. How many out of 7 do you think are uninsured? Any guess is a good guess because it's worth $25 of a Target gift card. That's close, Ava. Julie, you're very close. There you go, Julie Ferris.
No, Georgia came in under the wire. Georgia
Yeah,
by a hair.
Okay, we're going to rely on Reese to get us your name and our email address, and we're going to email you the digital card. It's 1 in 7, which is about 14%, which seems high when you look at other data that talks about what used to be a 7% uninsured rate in Orange County, but it's obviously gone up during the pandemic. And then along with that, we have to look at the fact that not all people are counted. For example, people that are undocumented are not necessarily stepping forward to be counted.
Yeah.
So good job on that. So we're going to move on to talk about social service options. And so we're going to go to the next slide. And the process there is very similar to the one that Maricela just shared with you in terms of health access. I'm sure you're aware that out of City of Irvine or City of Tustin, those are actually federal monies that are coming down. Your internet connection is unstable. That's not good to hear. This slide here reflects the path that individuals can take. They either can apply themselves directly online, or they can go to an office, or for those that are the type of people that we serve that have more barriers, they oftentimes need the help of an assister. And the assister is explaining to them what benefits that they're eligible for, and then how to apply, and then helping them apply. I wanted to just give you a couple of examples of some of the different types of benefits, because, for example, through the state of California, we have the Department of Rehabilitation for a range of vocational services for people with disabilities. And they also support what's known as the independent living centers here in Orange County. That's called the Dale McIntosh Center. And that's a different type of benefit than you're going to find with the County of Orange or necessarily with the federal government. And so the example we gave with the federal government up in the top there of the slide is the Social Security or supplemental security income. Whereas in the bottom slide, it shows more so what the County of Orange is offering in terms of Medi-Cal, CalFresh, CalWorks, general relief, refugee assistance, the earned income tax credit, and then support from housing. A lot of these programs are going to then subcontract out with another agency. So for example, the California Department of Rehabilitation, what they have on their staff are counselors, and it's the counselors that are going to refer them to a program, let's say for job training, and that's how they'll get their support so that they can either get a job or get a better job is through that job training. That's a small example. Let's go to the next slide, Maricela. So this slide talks more specifically about how the options that people have in Orange County in terms of applying for some of the services we talked about in terms of Medi-Cal, Covered California. You can either apply online or go to the Social Security office or visit our office, and we provide our information down at the bottom. As Maricela said, we do have 22 partner sites, everything from probation offices to family resource centers to behavioral health to women, infant, children, just to a wide range of locations where we're most likely to find people that are eligible for Medi-Cal, and maybe people that have more barriers that really need some extra assistance. I'm going to go to the next slide. And Maricela is going to talk about that.
Yeah, so this is the part where I have the most experience. So the role of a community health access assister. We do multiple things when we're out in the community. The main one would be outreach. So we participate in many health fairs, parent meetings, parent groups from different schools. We also try and do phone banks, mass texting, mass emails, and that way the families know that we are there to help them and assist them. We do a lot of education. So during our parent meetings, we do what we call our Know Your Benefits presentations, where we explain in further detail what the programs cover, what they can obtain with CalFresh. When we're sitting with the clients, we also do a fair amount of screening. Like we mentioned, immigration status is not just one eligibility criteria. We have to take into consideration their income, their family size. If it's an aunt that's trying to get enrollment for their nephew because the parent doesn't have custody, different types of things can determine eligibility for different types of programs. And of course, we help them with the enrollment process into all of the programs that we had mentioned previously. And we also help with the navigation. As you can tell, applying for Medi-Cal isn't the last step. Cal Optima comes into play. So we want to make sure that they know how to navigate the system. If they need help making their first appointment, we help them with that as well. If they need help with transportation, again, we connect them to Cal Optima to be able to get that covered. But we also help a lot with problem solving. So there's two different functions when we are speaking about obtaining medical insurance. Medi-Cal is your insurance, and then Cal Optima is the provider. So if there's an issue with a doctor, they want to switch a clinic, it's too far for them, they want to get somebody who speaks their own language, we help them coordinate with Cal Optima to do that. But if it's an eligibility where they canceled the Medi-Cal, their insurance, they don't know what's going on, they forgot to submit their redetermination packet, that's more problem solving. We sometimes end up doing a three-way call with social services, the client and us, because sometimes the clients feel a little bit more comfortable having somebody there to speak on their behalf. A lot of the times they may not even know what questions to ask, or they just get too nervous and don't even know how to move forward with the questions. So we do a lot of that as well. And of course, we want to make sure that there's no lapse in coverage. So we help the clients with their renewals. And then for social service programs, referrals, again, if we know that these families may qualify for additional help, we try to connect them with those referrals so that they can get assistance either through getting help through their utility, or if they need a more help with WIC, we can refer them there. If they've already applied with us for CalFresh, again, it's extra food for their children, and hopefully it'll keep them healthy. And the next slide. Sorry, okay. At the moment, with COVID, social services has been very lenient. So a lot of the families don't have to submit verifying documents at the time of application because we are doing it over the phone. However, if they happen to request a specific document, one of these documents is probably going to be the thing that SSA social services is asking for. Proof of income, birth certificates, proof of address, ID cards, proof of citizenship, social security cards, immunization records, and proof of pregnancy. Where a lot of the families kind of get stuck is, especially for proof of income, if the family only works and receives cash, they may not even know that they can submit a letter to prove their income. A lot of families, this is where they lose hope, because social services on the letter will say specifically, please send your most current pay stubs. And of course, if you're not familiar with the system or what you can ask or what you can send, people are going to say, oh, well, I don't have a pay stub. I guess I don't qualify. But again, we always encourage our families to call us back if they end up receiving something so that we can clarify and let them know that a self-affidavit is more than sufficient for the proof of income. And those are some of the strategies that we use with our families.
Bonnie, can we go back one slide to the One app slide?
It's not on the slide deck.
Okay.
Sorry. I know that's why I went back a little bit to confirm. Yeah. So So a little bit of the application process and what happens after they apply. When we submit our application through the One app system, which is the slide that we were missing, we're able to submit CalFresh, Medi-Cal, and CalWorks all in one sitting so that the client doesn't have to do 3 different appointments for those programs, or that they don't have to sit through for 3 hours to submit an application. Through that system, as social services is able to review it directly, and they're able to take 30 to 45 days to see the eligibility for the family. And then after they have been approved for Medi-Cal, then they will be assigned automatically to CalOptima. CalOptima is the managed care provider here in Orange County. Through CalOptima, like we mentioned previously, they are able to select a doctor. If they do not select a doctor within 30 days, then CalOptima will choose one for them. They're also able to select mental health professionals. Transportation services are available through CalOptima if they're members. And we can even help them make the first appointment with their primary care provider. And I think we're ready for another raffle, Gregory.
We are. I want to just say something about what we refer to as the One app system. That's a system that we're currently using, but transitioning away from, where the enrollers are able to enroll individuals into multiple programs online, and the applications go directly to the county. This system interfaces in Orange County with what's called the My Benefits CalWin system. And the state is moving to a new system called CalSAWS starting this year, and in Orange County won't be official until like April of 2023. But the CalSAWS system is basically the system that individuals use to submit applications and where eligibility is determined for the approval for the eligibility. I think most of you are learning almost everything you need to know in school. However, with that said, there are currently 3 different systems in the state of California. So wherever you live, you have to find out what system they're using so that you can learn how to use that system and integrate into that system. The new system, as I mentioned, we're transitioning away from that system actually as early as July. We're going to go to what's called My Benefits CalWin on a temporary basis. And then eventually, I heard the new name, Maricela, it's called Benefits Cal is the new My Benefits CalWin, but that's the portal that people use. I want to just share before we go to the raffle that you might say, well, how complicated is it just to apply for a benefit online? And well, you can see the problem we had with Zoom today. So there's some technology problems. But on top of that, or in addition to that, we're serving people that are at times homeless, experiencing homelessness, people that have significant disabilities, behavioral conditions, people that may not read or write English, so the applications are difficult even in their native language. We had a woman, she was in her 70s or 80s. She came in here 5 times to finish her application. And so that you can see that might not work. Obviously, she's not able to do it online, and that might not work at a social services office. So we're going to move on to the next raffle. Start spinning your thoughts, your brain, and the second question relates to the health improvement plan that I shared. But we're going to get you ready for the next report that we also shared with you, which is a profile including data, charts, and maps that was prepared by USC to talk about the health equity experience in Orange County. So going back to the health improvement plan, the one we sent you, and Reese was so kind to share another copy with you. It talks about a lot of things. The things that we're interested in, amongst other things, is how people find out about services and how they navigate them. So in that plan, they do talk about that process called access and navigation. And they list 2 partners in the County of Orange that are the lead agencies for this access and navigation. And I wondered if anyone can name one or even both of those agencies. If you can't, that would be expected, because how would you expect other people to know how to know what services are available or how to access them?
Yeah.
Any guesses? Okay. Oh, Melody, she knocked it out of the park. Congratulations. Yes, that's it. That's an interesting one, Melody, because CalOptima is the county organized health system, and Be Well is the newer system to both provide direct clinical services for people with mental illness and also develop processes, systems to bridge the gap between public and private mental health. Because currently, as you're probably aware, those systems are separate. And so this new effort in Orange County, we have the new campus in the city of Orange, and they're actually in the process of developing one in South County. I think it's a great effort. And I would add to that, though, that the more that those large systems like CalOptima and Be Well OC can connect with the community-based organizations that have the relationship, that would also be a very beneficial thing. So we're going to go on to the next slide, and Maricela is going to go a little deeper into CalOptima.
Okay, so, and I'll share a little bit of an experience of a client and what they have to go through if they need to switch providers. Again, like we mentioned with CalOptima, these are all the different medical groups that are under CalOptima. And this just goes to show you why it's so complicated, although CalOptima is managing most of this. Say that a client was enrolled, a client was enrolled in the CHIOC Health Alliance. That program is mostly for pediatric services. So when they age out, I believe the age limit is either 17 or 16, they need to move over to a primary care provider or a medical group that will assist them as adults. So say that they want to go from CHIOC Health Alliance, and through their neighbor, they heard that they were assigned to a doctor who works with Regal Medical Center. Since they're moving from a pediatric medical group, they would need to request to, if they want to see that specific doctor, they would need to request to be assigned to Regal Medical Group. After they've been, and that call, it goes directly to CalOptima to make that switch. After they've been assigned to Regal Medical Group, they then now have to contact Regal to sign themselves up to that specific primary care provider. And you could imagine if a family member or somebody who's not familiar with the process, they could easily get lost and be very discouraged to try and figure out how to go to that specific doctor. And the chances of them, getting a good doctor that they feel comfortable with are going to be, pretty slim. So doing follow-ups, going to the doctor, getting their physicals, it's going to be a little bit more challenging. So that's where we come into play, just explaining that process, and we help the clients go through that as well.
Maricela, before you move on, do you mind sharing the story about children's utilization of medical services compared to their parents in a mixed documented status?
Yeah, one of the things that we noticed, we were trying to really think about why some of the families, now that they obtained Medi-Cal, why they're not actually using the services. And it goes farther than just numbers and, research and reports, right? We have to take into consideration that many of these families are coming from countries where they might have had more, they don't have a lot of resources, right? So when they come over, the parents themselves can't access medical services. So they're referring to home remedies or accessing the emergency room when it's just unbearable or there's something that they really can't take care of on their own. So if the parents themselves have this mentality that, and they don't have this ease of going to the doctor, that kind of translates over to how their children are going to be taken care of. So if the family is able to take care of it with the home remedy, that's probably going to be their first option, instead of just going directly to urgent care or to call the primary care provider's office, because they themselves are not doing that. So we feel like it's something that it's generational. So that's why we feel a lot of the times the children aren't accessing the services as they should. And that is where our education and our Know Your Benefits trainings come into play, to let the families know that they do have access to these and that it can be easy and that we can help them. Did you want to add anything else to that, Gregory?
No, that's fine. We can go on to Covered California, and Reese, unless there's any questions.
Okay.
Not
We'll
seeing
move-
anything so far.
Okay. So what happens if you're not eligible for Medi-Cal? What other options are there? We have Covered California. Through Covered California, the reason why you would want to apply here is because based off of your yearly income, California is going to help you with a certain amount to get any of this, the plans that we see here. So say that you chose Kaiser, and Kaiser's monthly premium is $150. If you go into Covered California, submit your application, at the end, they'll say, okay, we'll help you with $100 a month for your premium. When you get Kaiser, you're just going to, instead of paying the $150, California is going to pay $100 and you will pay the difference. So you'll pay $50 for that insurance. And that's the reason why you want to apply through Covered California directly. And again, for those who are over the income limits for Medi-Cal, if you're a resident or a citizen, Covered California is your option. Normally, we do have open enrollment from November 1st to January 31st. This year, of course, because of the pandemic, fortunately and unfortunately, they will be open to the end of the year. So anybody seeking coverage will be able to obtain this. In normal circumstances, open enrollment is only between those months. However, if they missed open enrollment, the only other reasons they can obtain services is if they fall under what we call special enrollment. And that's if they moved from one state to California permanently, had lost their coverage within 60 days, whether it be a job loss or they no longer qualified for Medi-Cal, they got married or divorced, if they turned 26 and were no longer eligible for the adult to be in their parents' insurance, or if they just had a baby. One health plan that we're missing here is Anthem Blue Cross. That is one of the other ones that are here in Orange County. So it's Kaiser, HealthNet, Molina, Oscar, and Blue Shield. Those are the plans you can choose through Covered California. And then I'm going to bring it over to Gregory for this slide.
Here, we just, so what we've done is talk to you about the large system, how the system and processes work in Orange County. We've talked to you about how CHIOC services operate, and we just want to touch on some of the data here for Orange County. I provided in this slide sort of a snapshot on the top from UCLA in terms of it's older data, but it showed you that there was a total of 264,000 individuals that were uninsured. And you can see the breakdown to the right of that for which category they fall into. We have to add on to that what Covered California announced a couple of months ago in terms of the people that lost insurance due to their loss of a job. And so that's about just under 90,000. So even if you take 90,000 plus 264, what is that? 354. That, and you divide that into Orange County's population of 3 million or 3.2 or 3 million, it comes up to around 11% or something like that, which is different than the 14% that I showed you earlier. That's why I'm saying it depends on what data you want to look at. But the point I wanted to make is that it's obvious that the pandemic has really had an impact on Orange County and the state and the country in terms of people that are now uninsured. And I'm sure perhaps you've studied it in your classes, but you know what are the consequences of people if you don't have health insurance. You're probably not going to the doctor unless it's an emergency. And so you're not managing your health overall. What the data on the sort of the middle and the bottom of the slide are what are our enrollment numbers for California. It's broken into 2 different years. And 2019, you can see that there were 2,603,000 new enrollments, where it dropped in 2020 to 2,385,000 enrollments. And that was quite a shock to everybody. That the Department of Healthcare Services and CMS, others had projected enrollment would grow, but it actually shrank. And so the experience we've had on the ground is that if you're afraid of getting infected, you don't want to go to a medical facility. And so if you're not going to a medical facility, you don't need health insurance. And so that sort of explains why the new enrollments have dropped. However, what the federal government and then Department of Healthcare Services has done is they've allowed people to continuously renew their insurance. It's an auto renewal. So the total caseload has jumped up from 12 million to 13 million. And so the percentages are about the same. So in other words, there was an 8% drop in new enrollments, but a 7% increase in the overall enrollment in the caseload because people weren't dropping out. I think I'm sure you've had it in one of your classes, that the different communities or populations that are most affected. And so I don't think we need to go over that with you now. I think it's been on the news, it's been in the newspapers, and I'm sure you've probably all even written papers on it. What between myself, and then I'm going to draw Maricela in for just a moment to talk to you a little bit about the barriers that exist for people. And I mean, a lot of it is, it's hard to put your shoes in the lives of individuals that are struggling to get through the work, family, and life. And so if you're working 2 or 3 jobs, when do you have time to go to the social services agency? And if you're making minimum wage or less and maybe don't have 40 hours a week and your paycheck's not that big, you might not have the proper, you might not have the technology, the tools to apply. Maybe you don't have internet at your home, the digital divide. There's also, as Maricel talked a little bit about, people's that have come from different countries, or people that were born here that don't have an appreciation for the need to take care of their health. That's another reason people don't apply. Of the people that are qualifying, only a smaller percentage of them have vehicles to get to a social services office. So that's another barrier. I'll draw you in, Maricela, if you want to share any other barriers, put you on the spot that you think exists why people don't apply for Medi-Cal.
Yeah, I have 2 that come up really quickly. One with COVID, obviously, if your family is relatively healthy, you're not affected directly health-wise with COVID, but you might have lost hours in your job, lost your one parent or both had lost their jobs. Their main priorities are more immediate. Those are so putting food on the table, paying for utilities, paying for rent. So if you're not needing any medical services, that's the last thing in your mind. You want to make sure that your children are eating. So that's going to be your primary source of where your attention is at, right? The second one too is for the past couple of years, there's been a lot of talk about public charge. For those who may not be familiar, public charge exists when somebody wants to become a resident of the United States. They do a public charge test to see if that person is going to be very reliant on the government for support. Some of the programs they were trying to include in public charge included Medi-Cal, included CalFresh. Fortunately, none of those proposed rules had passed. However, the fear still is very prominent within our community, our immigrant community. So there is still a fear of if they obtain these services, if it will affect them, if they want to adjust their immigration status in the future. We do the best that we can. We provide community forums and invite immigration attorneys to come and speak on that, just so that the families know that it is safe to obtain these services. And of course, as you know, bad news is the one that spreads the fastest. And unfortunately, that one was one that our community really stuck on. So as much as we try to educate them, show them what the right policies are, the fear sometimes takes over and they just rather not take a risk. So that those two, unfortunately, are some of the factors that we think also are due to the lack of enrollment, especially during a pandemic.
So we're going to go to we're finishing up here. We're going to go to one of the last slides here. But before let's go to the slide, and then we're going to do a raffle. Okay, it's that third and last gift certificate. According to the report that we provided you, the inequity profile of Orange County, which Orange County racial ethnic group is most likely to have no usual source of care? That's the question. Okay, Julie, you got it. Is that the second time, Julie, or the first time? Okay, congratulations. Thank you for reading that report. We hope that those reports provided you a little bit more insight in terms of what's going on in Orange County. And we're hoping that this presentation increases your awareness and also persuades you to advocate for increased access for everybody. You know, during this pandemic, it's been a difficult time, perhaps for some of you and some of your families or people that you know. What we've focused on in the short run is not only mainline access to healthcare, but as you can see from the slides, we've also helped navigate people over to different resources. Sometimes it's cities, sometimes it's United Way, sometimes it's the county to help with it, like food and rent and mortgage support or assistance with utilities. And we talked about it a little bit earlier in terms of the problems with people not seeing their doctors is that delay in care. And then finally, which many of us have experienced, I think, some people more than others, but the mental health impact. That it's obvious that mental health is taking on a larger level of awareness in our country and in our local community, and that's why the Be Well OC movement is an excellent tool to try and help more people get that kind of support that they need. But certainly that's led to, as we talk about isolation, anxiety, and depression. I think that takes us to the end, Maricela. Let's go. Okay. Oh yes. No, we need your support. we as I mentioned a little bit earlier, people don't know about these benefits, and so your word of mouth, your sharing it with others is important. We can't be thankful enough to Dr. Bilemek and a group of students that he's working with, which is giving us some guidance on our social media strategies at the moment. Next, we're going to ask Dr. Bilemek for some support on the other ones. Helios, thank you, is the group that's helping out, and we really do appreciate that because messaging is just so important. So there needs to be more support, more advocacy in this area of marketing and outreach. So I think we are at the end of our presentation. We would love if you had any questions that we could try and answer, but we really appreciate your time.
So I don't see any questions in the chat. If questions come through, I'll let you know. I wanted to thank you again, Gregory, for coming to speak with us today. And I hope that our students who've been listening are getting a greater knowledge foundation in terms of what resources are out there for helping patients who either don't know their rights in terms of a patient or healthcare access, or in this case, really discovering or helping navigate our incredibly complex system of how to sign up for healthcare. So I hope that people are kind of sensing a little shift in today's theme from previous days when we were kind of just talking about the meat and potatoes in terms of the different types of insurances, and now we're getting into what resources are out there.
Reese, we appreciate this opportunity. We wish all of your students well in their careers, and we'll connect with you afterwards for those names and emails so that we can get you those gift cards.
Sounds great.
Thank you. And I'd like to leave my contact information. Please don't hesitate to contact me if you have any questions. If you yourself have somebody in your family or your peers that may need some guidance, we're all here to help. So feel free to reach out to me.
Yeah, because Maricela and Gregory, the most of the attendees here are at various stages of their medical training. So they're interacting with patients that might benefit from accessing resources. Is there an easy, is simply calling this general number for appointments? Is that a good starting point if they wanted to refer a patient to speak with your team?
Yes, definitely. When we answer, they'll be able to set up an appointment or just answer a simple question if they need that.
Yeah, so please grab this and keep it in your little, pocket reference, because it's I think especially when we're rotating through the FQHC, there's commonly opportunities to connect people to both to health insurance and also to some of the social programs that CHIOC helps promote access to. So thank you so much, Maricela and Gregory. This was great. You just gave us exactly what we needed, and we look forward to continuing to collaborate.
Thank you kindly, Dr. Billamek, and thank you all for your time today.
Thank you.
Thank you.
As usual, our feedback link is up. Please give us your feedback. We want it. It helps us improve from year to year. And our next session will be starting very shortly.